and welcome to Health Digest. I'm Ukeme Etuknwa, and it is such an honor to be your host on today's edition of the program. If it is your first time of tuning, I like to say welcome without sounding like a broken record. Yes, because we have so much lined up for you. Health is definitely wealth, and my aim today on the show is to keep you optimized to ensure that body, soul, and mind, everything is moving in unison. It is that one-stop program that aims to optimize your health and ensure that you are living your best life. Now, on the show today, we have so many things packed up for you. We're going to be looking at health news, the latest happenings in the health field. We're going to be looking at the national scale, the international scale, and we're definitely going to be zeroing it down into what is happening in our community. We're going to be looking at outreaches and interventions on the program today, as well as health tech and innovation. All that's coming right up on the show. You are most welcome. I am Ukeme Etuknwa. Stay blessed and not stressed. Here is your health news.
The National Coordinator, Dr. Abdul Mukhtar, explained that creating a more supportive and business-friendly regulatory environment will encourage investment in pharmaceutical production, reduce dependence on imported medicines, and improve the availability of essential drugs across the country.
PCN has really been doing a lot to improve on their efficiency. They have launched e-pharmacy regulations to regulate all the digital practice for pharmacy, and within that, and we're looking at areas where we can also support new initiatives like compounding in the country, because it's part of like community pharmacy practice. So really whatever we're doing is really to make sure that we put in, again, we say we're building the ecosystem. You cannot have a good ecosystem without a good, efficient and professional regulatory environment. And that
Registrar of the Pharmacy Council of Nigeria, Fam Ibrahim Ahmed, described the partnership as a key step towards achieving the governance objectives of the Health Sector Renewal Initiative.
Critical to this is the fact that we have the responsibility to operationalize the National Drug Distribution Guideline, and that's the entire healthcare value chain. And of course, that sits perfectly very well with PVAC. The issue of health technology, the IT, the e-commerce, is also an attempt to improve universal health coverage, which of course falls under the mandate of PVAC.
The initiative is also proposing a framework to support compounding practices within community pharmacies to expand access to medicine at the grassroots.
So I'm going to start with a little bit of some health technology. So I'll bring you those details. You know what? Just check it right out.
Imagine technology that doesn't just tell you what to do, but physically guides your movement in real time. That's the idea behind the Human Operator, an experimental wearable AI prototype created by a 6-member team of students from the Massachusetts Institute of Technology. Developed during the MIT Media Lab's 48-hour HAD mode hackathon, the device uses electrical muscle stimulation, or EMS, to direct a user's hand and wrist movements. Described by its creators as a GPS for your muscle, the system combines artificial intelligence with wearable technology to trigger physical motion instead of relying on visual instructions or audio feedback. Small electrical signals are sent to specific muscles, gently guiding the hand through the movement in real time. The technology could have major implications for healthcare and rehabilitation, particularly for patients recovering from injuries, strokes, or motor impairments. Experts say systems like this may one day assist with physical therapy, skill training, and even remote medical support by helping users perform precise movements more accurately. While still experimental, the project highlights the growing intersection between artificial intelligence, human movement, and healthcare innovation. As wearable technology continues to evolve, the research believes tools like the human operator could reshape how humans learn, recover, and interact with the machines in the future.
And that's it when it comes to health tech on the show today. I'm going to be giving you a chit chat with the expert in just a little bit. Before I do that, I'd like to bring you our outreach and interventions. Yes, we're talking health here on Health Digest. We had a bit of a chat with the leaders of tomorrow today. Where would you call them? We had a chat with adolescents. Yes, this was for a UNESCO and Seaway partnership to promote health in the community. So I'll bring you those details. You know what? Just check it right out.
Nigeria has a HIV prevalence of 1.4% among adults, with approximately 2 million people living with HIV. Annually, there are about 22,000 new HIV infections and 15,000 AIDS-related deaths. Children aged 0 to 14 accounting for 15,000 of these deaths. The National Agency for the Control of AIDS held an event educating young people on HIV/AIDS prevention, emphasizing that AIDS is not a death sentence. The key focuses included the abstinence and safer practices, promoting condom use, testing, and reducing stigma.
The objective of this conference is to create awareness, is to discuss how the youth engage with prevention strategies, and then 3, to discuss ways of empowering the youth. Because you empower them, then you're enabling them to make informed choices and better choices.
It also had students involved in advocacy by creating the platform for discussions, creating awareness, and launched the initiative PMTCT, Acceleration Committee, to reach more communities.
I want to start maybe engaging into any activities, any such activities. I would first of all know those contraceptives that we all have here. We have pills, we have birth pills, we have condom. There are many more. So you first of all have knowledge concerning it, and then I feel when you do, then you know how to use it to save yourself from getting STD.
NACA aims to end AIDS in Nigeria by 2030, urging collective action, equity, and sustained funding. With World AIDS Day on the 1st of December and the theme Take the Right Path, Sustain HIV Response, Stop HIV Among Children, NACA has called on Nigerians to break the stigma, support testing, and join the fight. I had a discussion with the Director General of NACA, Dr. Temitope Ilori.
Welcome right back. I hope you enjoyed our outreach and intervention sections. We have very little time left on the show, but I'm not going to leave you right that. I'm going to bring you a conversation I had with the EU delegation. That's correct. As you know, the EU and Nigeria have been strategic partners for quite a number of years in so many different areas. Just check it right out.
It's a sustainable partnership, and I like the fact that, we're looking inward to see when it comes to the chain of production in what particular area, because World Immunization Day was just a couple of days ago. So you mentioned vaccine production, and some of the questions that a lot of Africans and Nigerians have had has had to do with African-made vaccines, Nigerian-made vaccines to suit our biology, our own makeup. That is quite interesting. So something also very interesting happened during our conversations. For those watching, they would notice that at some point, the lighting changed, and that's because there was a change in power. So I can imagine for those in the health and the medical setup, this must be a challenge. And I know that the EU has done quite a couple of things when it comes to the Solarization project for health. Can you tell me a bit about that and its importance?
Yeah, now let me be very clear. We've been working on solarization, as you put it, of primary health centers and health facilities for many years. Especially part of the Borno package, all the health facilities that we built in the Northeast, they include solar power installations. What has emerged though is that when you create a solar power installation in a primary health center, it is very difficult for the primary health center to manage the installation. Okay, the first problem that occurs about maintenance or repairing. People really are at a loss because primary health centers don't have electric engineers among the staff. So what we have designed more recently is a different approach. Is to say, and we call it a solar to health. Say, okay, governors, please come forward if you're interested with us to support a number of your health centers, but the vision there is to have solar installations that serve the primary health center, but they can be run as a separate business by, let's say, independent installation managers. So the installation manager comes in, chosen by the state, chosen by basically by the project or by the primary health center directly, and they will be responsible for the maintenance and the management of the infrastructure at an agreed tariff, because in an event it doesn't have to be for free, it has to be cheap, but not necessarily for free, and also with the possibility of using the same installation for other business activities or even residences around the primary health center. So the same installation can provide electricity to housing, to the little shop, and so on and so forth.
So which geopolitical zones would you say this strategy has, started off in the last 2 years?
Exactly. We are broadly present in all 6 geographical zones. I must say, though, that the Southeast governor, they were particularly keen on this type of projects, and South-South, they're also very responsive. But we are also present in Jos and elsewhere in the North Central and beyond.
Wow, thank you so much for that. I found out from a couple of field activities that when it comes to sustainable development, if you can get the community to be a part of it, like you've mentioned in the area of maintenance, and you've also, the EU in partnership with its Nigerian stakeholders have also provided a form of health entrepreneurship in that project. Thank you so much for that. Looking at some other areas, I'd like to know, health goes across, I would say, 3 major stages. There's the community engagement, there's also the stakeholder engagement. When it comes to the decision makers and policies, how has the EU, further pushed the mandate of health for Nigeria?
Now, the last few years, and I've been back to Nigeria only since 2024, although I lived in Nigeria before, but let's say the last 2 years we've been very lucky with Minister Pate, who's an extremely qualified and competent and active and dynamic minister and a great leader too. So what, probably something that you know already, the swap, the health-wide approach that we pursue here in Nigeria, meaning that all the donors and the government will work together to precisely address the main challenges that we tackle. Of course, the primary health is still the primary issue, and as European Union, we remain committed, especially in some states, and especially with the focus on the young girls. Okay, we believe that that segment, young girls and to some extent really young males, it's very important for the overall welfare of the country. It touches on maternity, it touches on rights, really empowerment of youth. So we are active in Sokoto, in Kwara, but in different ways we are also very present in other states. The health sector, as you know, is a shared business between federal and states. Okay, the delivery of the service finally lies in the hands of the state.
Yeah.
At general level, a strategic level, as I said, for example, on health manufacturing, it makes sense to work at federal because there are so many institutional mechanisms that you need to fix and create the right enabling environment, a regulatory environment, and it helps a lot to work on federal. It helps a lot to be with the federal government on, for example, general definition of a mission of a primary health center. But when it comes to measuring the investment into health, you need to be at the state level. So a big discussion, if I may say, that has been going on for many years and where we've seen a change is the ability of states to put more money in health and to prove results for their investment. This is a big issue in Nigeria because health has been underfunded, and now we see more funding going into health, and we see really even better monitoring, better assessment of the public funding and its use in the states. It's been an area that is not necessarily really, for us, it's not really about naming or shaming or about making our health condition.
I did want to ask that, yes. Yeah. Is there some sort of, some of these funds are from the EU and from different organizations. Is there some sort of scorecard that you go back and evaluate? I know that you have normal monitoring and evaluation in there, but is there some sort of way that you get a scorecard so you know which particular stakeholders are actually bringing the impact? You mentioned like with the Solarization project, after going back to the books and looking at the project, you realize there needs to be some sort of community input when it comes to the maintenance for Solarization to actually work for better healthcare. So is there some sort of scorecard systems? Because I do see a lot of funds coming in, but sometimes the public wants to know. We might not get to know because these conversations are in closed door, but is there some sort of, scorecard?
Look, if you look, for example, Sokoto State is a state where we are doing a lot of work. And we've seen the health budget really going really high. I mean, besides our intervention, the state is investing a lot more than before. Okay. And I was there, and you were accusing me of touring too much the country. But when you see really the Commissioner for Health in Sokoto, same thing, by the way, also in other states, and I would mention Borno in the northern context, their commitment to improve delivery and also the role of their national assemblies to review the expenditure is already quite comforting. Things are changing in Nigeria. People are not so gullible, I would say. I mean, they know that, if you are pregnant, you have to be treated for free and, with good quality treatment. Same thing for immunization. I mean, people expect quality. So that's really happening. Then I would say the Governors Forum is an institution that we have here in Abuja, and they do the famous scorecards. So not for me now to mention anybody in particular, but they do check the level of, for example, investment of each state into the health sector, and also to a large extent the results they achieve, because discussion we had recently with the governor in Nasarawa for health For education, yes, you can improve, you can increase the investment, but then you also need to know really the outcomes. You can invest a lot in new schools, in new buildings, but if the level of teachers is very low, yes, education will not improve. Okay, although you built and flagged off 200 schools. Yes. Okay, so of course it's not an easy assessment, yeah, when it comes to impact. But governors are broadly, let's say, developing their strategy. And, having lived in Nigeria before, I see a change of gear in most states.
Thank you so much for those insights, because it's quite important for the public to know that we are having positive changes when it comes to our attitude to health, public health, and so much more. So another area that I find quite interesting in the world of health is innovation and technology. Yeah. The world is moving in that direction, and Nigeria, I mean, being what we call the giant of Africa, is definitely a decision maker. What would you say are some of the strengths or wins when it comes to innovation technology in health in Nigeria?
Can I start from a recent example? We had the Health Forum last year, November 2029, I think it was of October. An important European company called Bayer, probably you know of Bayer, they came to the country and they announced their partnership with a Nigerian company called Promedics, it's Anambra State. They are going to produce contraceptive drugs and devices, last generation, best quality, best available quality, through a transfer of technology here to their counterparts. Again, as I mentioned this one because it marks really a comeback for Bayers into the country through a partnership and based on an assessment of the capacity of the partner. Which means that Nigeria has the capacity to make things happen. Okay. Now, when it comes to indigenous innovation, this is where we are supporting NIPRIT, the Institute for Pharma Research and Development, because there are big pockets of the health sector where Nigeria is ready to produce, is already producing innovation, is already producing new solutions. The problem is that the ecosystem to validate the innovation, to test innovation, to commercialize innovation is not necessarily there. Okay. I'm not only talking about dogoyaro remedies, which by the way, I think that we should use more, but also really solutions for Lassa fever. For example, this is an ongoing discussion that we want to progress. Treatments for malaria, and so on and so forth. So what we are trying to do is to help Nigeria to have the right ecosystem so that innovation can prosper, can really take up as it should. Then there are tools, there are financial tools, there are access to funds, finance issues that we try to address. There are research funds that are available also through participation in the EU Horizon Europe program. So there are global calls where Nigerians participate, part of a consortium, a global consortium. But I think that really we need our own system. Yes. Nigeria talent is everywhere. So you will always find Nigerians in any world global initiative, but then are we really capable of structuring our own initiative here at home? And this is what we are really working upon.
And it's been absolutely amazing. It's been great talking to you, hearing about these amazing things. Will you take us to at least one of these locations to look at what the EU has done on the field?
Well, with pleasure. Let's see next time the opportunity arises to see maybe a Solar for Health or Kwara, Sokoto, depending on your availabilities. Probably Kuala will be next for me because I was in Sokoto not long ago. But otherwise, there's more to say. Even elsewhere, as I said, in Borno, in Abia, in other states where we can see this.
Amazing. Nigerians, listen to this one. What has been your favorite state so far since you've
No. As I said, I tour a lot because I love the whole of Nigeria. No state excluded.
He answered pretty well. Thank you so much for your time. It's been an absolute pleasure.
Thank you very much.
Today on Women's Health, what if women had only their period once every 3 months? That's one of the questions being explored by Chinese biologist Hongmei Wang, whose research is focused on extending fertility and slowing reproductive aging. Working at the state's key laboratory of stem cell and reproductive biology in Beijing, Wang and her team are studying whether reducing how often ovulation occurs could help preserve the healthy eggs for a longer period of time. The idea is based on the fact that women are born with a limited number of eggs, which gradually decline with age. Researchers believe that if ovulation happens less frequently, such as once every 3 months instead of monthly, it may help slow down the depletion of eggs and potentially extend fertility. The research is still experimental, but scientists say it could one day influence the future of reproductive medicine and women's health. Experts, however, stress that more studies are needed before such approaches can become widely used. That's it for us today on Women's Health.
Thank you so much for staying tuned to Health Digest today. I really do hope you enjoyed the show. Do not worry, that was just one part of our conversation with Massimo. On the next episode of Health Digest, I'll be bringing you part 2 of that conversation so that you can take advantage of the opportunities that Nigeria has for our health sectors, from economics, policy, and skill acquisition. Stay blessed and not stressed. I'm Ukeme Etuknwa. It has been such a delight. Bye.